If you are a senior on Social Security or disability benefits, there are new rules that are going to take effect on March 31st, 2025. And there are things you have to do now in order to prepare. I have all the details for you now. You cannot delay on this because it's going to impact the services that you can access with the Social Security Administration. So stay tuned for all the details. And then I have another breaking news about the 2025 rules for working while on Social Security. So if you are receiving Social Security and you're still working, these are rules you need to pay attention to in order to avoid your benefits being reduced. And then stay till the end of this video because I have something that you need to do before March the 31st. I know there are two things here that I'm talking about today, but you have a last opportunity to change your Medicare plan until the fall, and that deadline is March the 31st. I'm going to speak to you in detail about that. So, who are we and what do we do? We are Benefits Insider, and for over 15 years now, we have been helping seniors get the benefits they deserve. Our mission is to help you stay on top of your Social Security, Medicare, Medicaid, and other benefits, and maximize those benefits by tapping into information and resources you probably did not know existed that could help you maximize your benefits. If you're new here, hit the like button, hit the subscribe button, because all we do is bring you the latest news and update, anything in and out of Congress that will affect your retirement benefits. And as always, before we get started, I want to know where you're watching this video from. Go into the comment section. Let me know your city and your state so that we know where you're watching this broadcast from. So let's dive in. Now, I talked about a March 31st deadline. This is critical. New changes that have just been passed, and they're giving you a very, very small window in order to make the necessary changes to adjust. And this is going to impact all Social Security beneficiaries that are currently getting benefits and future beneficiaries who are going to be applying. This is game changing for how you deal with the Social Security Administration. Let's get into the details. So, what is this about? Well, the Social Security Administration is implementing stricter identification verification procedures starting in March 31st, 2025 to combat fraud and protect beneficiaries. These changes, however, will significantly alter how people interact with the Social Security Administration for benefit claims, direct deposit updates, and potentially Medicare enrollment. Now, beneficiaries will no longer be able to verify their identity over the phone. It used to be that a lot of seniors who would rather get on the phone and take care of business will call the Social Security Administration to do any task that is related to their benefit, ask questions, change their direct deposit. If there's a discrepancy on their check, they can call. All those services are now being moved to either online, where you have to verify yourself online, or they are being moved to Social Security offices. So you're not going to have the option to call and get some of these services done over the phone. And I'm going to explain to you why they're doing this. So you will no longer be able to verify your identity over the phone, require either online verification through the My Social Security portal or an in-person visit to a Social Security office. This recent change is going to affect accessibility and could create barriers for some beneficiaries. The new requirements may disproportionately impact those with limited internet access, computer skills, or mobility issues. Seniors, people with disabilities, and rural residents may face major challenges navigating these new requirements. Now, the timeline for implementation. These changes take effect March the 31st, 2025, giving beneficiaries limited time to prepare and adjust to these new verification methods, which I'm going to explain to you. Current systems will remain in place until then. That's why there are certain things that you need to do right now in order to prepare, and I'll tell you at the end of this segment. Older Americans who lack reliable internet access or struggle with digital literacy will face significant barriers to accessing these benefits. So when you ask, Who is this going to impact? This is one of the groups. Many seniors rely on phone services and may find it difficult to navigate online verification systems or travel to in-person appointments. People with disability are also going to be affected. Those with mobility limitations, chronic health conditions, or disabilities may find it extremely challenging to visit a Social Security office in person. Online verification through ID.me or login.gov can be difficult for those with current disability or access to required documentation. Now, I have used or tried to set up an account to access my Social Security benefits and my IRS account, or to log in into the IRS using ID.me. And I had to jump through several hoops. I had to do some things on my phone, and then I had to go on my laptop and then get on a video call with somebody in order for the person to identify me as the person who I say I am. And then I had to go back on my phone and complete the rest of the transaction. I mean, it was not easy, but it was not difficult. So if you are fairly computer literate, you should be able to create an ID.me account, and then you can use it to access your Social Security account online, which will then smooth the path for you if you need future help. But if you cannot do that, and creating an ID.me account or login.gov account is difficult for you because of technology or internet access, then your best bet is to make an appointment and go to a local Social Security office and get your services that you need addressed. People living in rural areas often face longer travel distances to reach Social Security offices, with some needing to travel hours each day. With planned office closures, these distances will increase further, creating additional hardship for those without reliable transportation. Children are also impacted. There are certain children on Social Security either through survivor benefits or through disability. Children cannot have my Social Security account because you have to be of a certain age to set up that online account on Social Security. So it's going to create complications for their parents in trying to get services for children that are on Social Security benefits. So let's talk about verification methods and what is being required. The My Social Security account now requires verification through ID.me or login.gov, which demands documentations like a driver's license or passport and sometimes video selfies. These systems can be confusing for many users and require specific technology that not all beneficiaries may have. Now, there's also challenges to in-person visiting a local Social Security field office where you could just make an appointment or you could just walk in. Now you cannot walk in anymore. You have to absolutely make an appointment to visit a Social Security office, and they are closing some of these offices, making it even harder to get in and get your issues addressed. So, visiting a local Social Security field office will require scheduling an appointment, which may involve long wait times due to increased demand and reduced staffing because they laid off 7,000 people recently. Many offices have limited hours and some are scheduled to close, further restricting access. While beneficiaries can still begin a claim over the phone, they must complete the process in person at the Social Security office. This creates an additional step and potential delays in the benefit application process. Direct deposit updates will now be processed faster within one business day, but can only be made online or in person after March the 31st. This is an improvement, but it's also going to create accessibility issues because it has to be done online or in person. You cannot do it over the phone anymore. So, what are the potential challenges? With increased in person requirement and planned staff reductions of up to 12% of the Social Security administration workforce, people will likely face significant appointment backlogs and longer wait times. Some beneficiaries may experience weeks or months of delays in resolving critical benefit issues. The planned closure of 47 field offices across the country will further limit in-person services across the country. These closures would disproportionately impact rural and underserved communities where alternative services may be limited. Medicare enrollment for those not already receiving Social Security benefits will be considered a new claim. This is significant because some seniors are turning 65, and when you turn 65, you don't necessarily have to collect Social Security, but you have to get on Medicare with a few exceptions. And so it used to be that you can easily sign up for Medicare over the phone if you're 65. Now they are requiring you to go to an office to get it done. That is going to be a particularly challenging thing for seniors who don't have mobility or transportation. The SSA has not provided clear guidance on whether SSI redeterminations, which means that disability people who have to recertify that they are disabled or still disabled and continue or must continue to receive disability benefits, that process is now going to shift or may shift totally to in person, which is going to create another barrier for a lot of people. Why are they doing this? The Social Security Administration cites fraud prevention as the primary reason for implementing these stricter verification requirements. The agency aims to protect both the integrity of the system and beneficiary personal information. But critics argue that the rate of improper payments is not that much, less than 1% from a recent audit from 2015 to 2022, raising questions about whether such restrictive measures are proportional to the actual fraud risk. Are they overreacting to a risk level that is actually really low? The burden placed on legitimate beneficiaries may outweigh the fraud prevention benefits that these measures are going to yield. These changes highlight broader issues of digital equity in assessing essential government services. Many advocacy groups argue that alternative verification methods should remain available for those who cannot easily use digital platforms. And the new requirement may create a two-tier system where those with technological resources and mobility access can get services easily, while vulnerable populations face significant barriers. This raises concerns about equal access to essential benefits. So here are some things you can do now before March 31st, because that's in a few days. The first one is you have to go online if you don't already have an account and set up a My Social Security account immediately before March 31st, because after March 31st, the new rules kicked in, and now you have to use id.me or login.gov. If you need to change your direct deposit, do it now, because after March 31st, you can only do it online or you have to do it in person. If you need to go to the Social Security office for any reason in the next few weeks or a month or two, make sure you schedule your appointment now. Why? Because a lot of people are not aware of what's going on right now, that these new rules are going to be implemented starting March the 31st. So they think they can call and get their issues resolved, and they're going to have a rude awakening when they call and they're going to tell them you have to make an appointment and come in. And then everybody gets on the phone to make an appointment. There's going to be long wait times. And then the thing that you need to do will be pushed back months. So it's best to schedule it now before March 31st, before the mad dash to schedule in-person appointments because of these new rules that are about to kick in. And if you believe that these changes will negatively impact your community, make your concerns known to your elected officials. Constituent feedbacks may influence potential modification to these policies in the future. Call your congressman, call your senator, let them know you don't agree with some of these, and that is going to create unnecessary burdens on you or somebody you know, and why it needs to be eased, changed, or even scrapped altogether. Because what is the evidence that the current system was not working? That we have to restrict or eliminate majority of the phone services that seniors rely on, push them to technological solutions that they may find challenging, and then even push them further to do in-person appointments that may create transportation or mobility issues that some seniors have that could make it impossible for them to do. So make your voice heard. That's the point I'm trying to make. Now let's talk about rules for working while receiving Social Security. This is so critical because a lot of people end up losing money on their Social Security benefit because of that. 30% of eligible seniors claim benefits at age 62. It means they're claiming benefits before their full retirement age, often to make ends meet or pay bills. This trend was even higher in the 2009 recession, with 36% of eligible men and 39% of women claiming benefits. Poor health or physical limitations may prompt early retirement. Almost half of all beneficiaries that claim early is due to health problems, with 22% reporting impairments serious enough to potentially qualify for disability benefits. Debt reduction is another reason why people claim benefits early. And then fear of depletion. They're afraid that the Social Security benefits will not be around if they wait too long. Now, some people also claim early because of life expectancy in their family history or their current health, or a spousal strategy where one spouse is waiting while the lower claiming spouse gets the money now while the other person's income grows, their benefit grows until a later time when they can collect it. It may also be an investment strategy, or it may be that you need the money now and you need it now to live. Regardless, there are consequences if you continue to work. Those under full retirement age face benefit reduction if earnings exceed a certain threshold. Rising living costs may force continued work to supplement reduced Social Security income. About 40% of early claimants continue working part time to maintain their standard of living. Continued work can potentially increase future benefits amount through recalculation. Approximately 55% of Social Security beneficiaries who work after claiming see an increase in their monthly benefit later. Some may also work to maintain coverage until Medicare kicks in at 65. Nearly 15% of early claimants cite health insurance as a primary reason for continuing to work. But then there are limits that if you cross, you will lose some of your benefits. So let's talk about those. The earnings limit for 2025 is $23,400 for those under full retirement age. Social Security would deduct $1 in benefits for every $2 you go over that limit. Now, if this year is your full retirement year, once you hit that full retirement month, you can work up to $62,160 this year. If this year is your full retirement, and if you go over that amount by $3, you will lose $1. So in your full retirement year, this earnings limit is more generous. 23,400 versus 62,160 is a lot of money that you can make and not be penalized. And then previously, if you go over it by $2, you lose $1. In the full retirement age year, if you go over it by $3, you lose $1. And then once you cross full retirement age, you can work as much as you want and you will not lose any benefits. But what counts as income when it comes to the Social Security earnings test? Well, only income from work counts towards the limit, including wages, self-employment income, bonuses, commissions, pensions. Sorry. So it's wages, self-employment income, bonuses, and commission. What doesn't count is pensions, investment income, interest, annuities, and other government benefits do not count towards your earnings limit. So how do they reduce the benefits? If you expect to exceed the earnings limit, Social Security will withhold monthly payments at the beginning of the year. They calculate the total withholding needed and suspend your monthly benefit payments until the amount is covered. You should report your expected earnings to Social Security to avoid overpayment, which is a whole different issue. You don't want to get into an overpayment situation because they will stop your Social Security benefits and use your Social Security benefit to pay any overpayment until it's paid off. A lot of people have received some very nasty emails from the Social Security Administration asking them or telling them they owe $50,000 in overpayment that they have to pay back. And it's taking years for some people to be able to finally clear that overpayment bill in order to resume their Social Security benefit. In the first year you receive Social Security, you may apply a monthly test if you retire mid-year. This special rule allows you to receive full benefits for any month your earnings are below 1,950. And then there's an adjustment. After the tax year ends, Social Security will receive information about your annual earnings and make necessary adjustment based on data from the IRS. If too much was withheld based on your earnings estimate, you will receive a difference back. If too little was withheld, you will need to repay back the excess benefits. So who is affected by this earnings tax rule? Well, early retirees. The earnings tax applies to anyone who collects Social Security benefits before they're reaching their full retirement age. Full retirement age ranges from 66 to 67, depending on when you were born. The earnings test also applies to spousal and survivor benefits if you are receiving these benefits before your full retirement age. Your work income can reduce these payments according to the same limits and formula. And then working spouses. If you're married and your spouse works while you collect benefits, their earnings don't affect your payments. The earnings test is applied individually to each person receiving benefits, not to their household. And then there's disability. Different rules apply if you receive Social Security Disability Insurance, which is SSDI. In 2025, you can earn up to $1,620 per month, $2,700 if you are blind, without affecting your disability benefit, as those have separate, substantial, gainful activity standards. Benefit recalculation. When you reach your full retirement age, after you've been working and collecting Social Security before your full retirement age, Social Security will recalculate your benefit to give you credit from months when benefits were reduced or withheld due to earnings. This means most or all of the money withheld due to the earnings test will be returned to you over time. The recalculation essentially treats you as if you had claimed benefits later than you actually did. If you lost 12 months of benefits to the earnings test, your benefits will be recalculated as if you claimed benefits 12 months later than you did. Continuing to work may increase your benefit amount if your recent earnings are higher than your previous earnings. Social Security calculates your benefits based on your 35 highest earning years. So replacing lower earning years with higher ones while you work before your full retirement age could boost your benefits. And then there's annual reviews. Each year, Social Security will automatically review the records of all beneficiaries who have had wages in the previous year. If your latest year of earnings is one of your high 35 years, they will recalculate your benefits and pay any increase retroactively to January the following year. You should plan for this. Talk to your tax advisor to make sure that you understand Social Security taxes and withholdings. Think about Medicare when you consider all of this. And if you're self-employed, there are rules that you have to pay attention to make sure that you're complying with all these policies. And then remember, your full retirement age, things change regarding the earnings test. There is a monthly and annual test in recalculating how much benefits is withheld. Keep all your documentation and communication with Social Security because it may come in handy when you get hit with overpayments and they want their money back and you've probably done everything you were asked to do and the fault is theirs. You have to prove it. Otherwise, they're going to blame you and put it on you. And then talk to your tax advisor. Maybe delaying Social Security may be a good thing. Talk to your financial advisor. I don't play one online. So get the experts to advise you on when, based on your circumstances, is the best time to take Social Security benefits. So let's talk about the last opportunity to deal with Medicare. A lot of people are being dropped from Medicare. I saw this news article that I have been holding to talk to you about because people are in the wrong plan. 90% of seniors are in the wrong Medicare plan, and there are 24,000 Medicare plans out there. So it's so difficult to find which one in your local area that covers your doctors that you visit, that covers the medication that you want or you're on, and can meet your budget. Well, I have good news. Chapter Medicare, we've partnered with this great organization, and I have been creating content for seniors over 14 years now. We have never recommended a Medicare partner until now because Chapter is actually the real deal for three reasons. Number one, they are the only free, unbiased medical advisory firm that has access to all of the Medicare plans that are out there. The 24,000 that I talked to you about, they have access to all of it. The second reason is that their licensed agents do not work for commission. So when they get on the phone with you, they are not trying to sell you the best, commission plan. They're trying to find the plan that fits your budget, your needs, and your circumstances. And then they can save you up to $1,100 on average. But here's the thing, this window closes on March 31st. You need to call Chapter now if you want to make a change to a better plan. 539-205-2147. Why? Because, as I mentioned, if you want to avoid being one of the 90% of seniors that are in the wrong plan, call them. You have a week to get this done, or you can click on the link in the description to this video. There's a form you can fill out. They'll reach out to you and help you find the best plan for you. And these guys are highly rated, A+ with the Better Business Bureau, a lot of 5-star reviews online. They can save you a ton of money, and they are free and unbiased. So their goal is to help you find the best plan. So call Chapter, and they will be able to help you before the window closes, and then you don't have any opportunity to change your plan, and you're stuck with the plan you have until the fall. So if this is of interest to you, give them a call. And that is really all I have for you today. Thank you for watching. And until I see you on my live, I've been doing live videos every day. I will see you there.